As we always do at CIRM, we start with our mission to remind us why we are here, which is to accelerate stem cell treatments to patients with unmet medical needs. This powerful mission guides us in our decision making, both big decisions as well as the smaller ones. Regarding CIRM's standing program announcements, it's important to understand that CIRM now creates a seamless path from one stage of research to the next. The CIRM team is motivated and has created goals for itself to help projects meet their goals so that they can be eligible for the next stage of funding. We have substantially increased the number of program offerings per year, which allows awardees and applicants to know in advance when to apply for the next stage and, if successful, have a seamless stream of funding to help advance the project. For CIRM's translation and clinical stage awards, CIRM establishes operational milestones for each award and ties the funding under the awards toward the achievement of those milestones. As an example, if CIRM is funding a trial, we would set up target enrollment milestones over the course of the award and then a final milestone representing the end of the award. Then, based on your project's budget and timeline, at award launch, CIRM will dispense enough funding for you to get to the first operational milestone. Upon achievement of the first milestone, CIRM will then disperse enough funding to get to the next milestone, and so on for the duration of the award. If there is a delay in achieving a milestone, the next disbursement is held until the milestone is met. The awardee can either try to make the first disbursement last longer than originally planned, or if such funding has been exhausted, then it is up to the awardee to cover any shortfall using their own non-CIRM contingency funds until the next milestone is achieved. Conversely, if there are excess unspent CIRM funds available at the time the milestone is achieved, the awardee may automatically carry forward the funding into the next milestone period without CIRM's prior approval. If there are excess funds at the end of the award, CIRM also has a mechanism for awardees to use such funds to further the project or conduct similar research within CIRM's scope and subject to CIRM's prior approval. If there is a co-funding requirement under the award, CIRM will require the awardee to show cash on hand available to co-fund each CIRM disbursement at the minimum required amount before CIRM will release its disbursement. CIRM will check and reconcile the required co-funding at each milestone achievement point. Some key grants management takeaways from this new model of funding include the fact that budget periods are now milestone periods. Whereas before, a budget period would be time-based, for instance 12 months, milestone periods are flexible and can now expand or contract based on the achievement of the milestone. As mentioned, carry forward of a positive balance between milestone periods is okay and does not need CIRM's prior approval, while carry forward of a negative balance is not allowed and must be covered by non-CIRM support. There is no longer the need for any no-cost extensions, given the award period automatically adjusts. And finally, there are no prior approvals required to rebudget the CIRM funding, given CIRM wants the awardee to spend the funds in whatever way they deem necessary to achieve the next milestone. The only caveat here is that if a rebudgeting is a result of a substantial change in scope for the addition or deletion of activities from what was proposed in the original application, CIRM does require prior approval for such changes.